All right, let's get the afternoon started. Or the evening for Janet.
It's 3:30. It's not too bad yet.
Not too bad yet. All right, so get our after lunch session started here with Miss Janet. This is unfortunately her last one with us this year.
It is.
So make sure you ask her lots of questions, and she'll leave her email up again, I'm sure, at the end.
Yes.
So yeah, we all ready for this? Everyone good? Use the restroom. All right, Miss Janet, it's all yours.
Thank you, Sean. Welcome to History's Mysteries. Interesting ways famous people have died. So I have no disclosures on here. I do want to mention that the information that I gathered for each of these cases was gained through autopsy reports and historical reports. I didn't get any of this from National Enquirer or Facebook. This was as accurate as I could get it based on the time that this happened. There is one in here, we'll go over George Washington's death, and of course, you know, there was no autopsy, but medical accounts and eyewitness accounts all go back to this. So I've given it as accurate as possible that I could with my research. Now, the specific conditions, treatments, everything else that we talk about today are the most current, up-to-date, evidence-based treatments that we would have given today if that person were in our service area. So Karen Carpenter is the one half of the duo, the Carpenters, a famous brother-sister duo from originally from Connecticut, but they sang soft rock songs from the 60s and 70s. She was 5'4", and she started dieting in high school. Her mother was very, very hypercritical of her appearance, and so she had this body image complex. So she really thought she was too heavy, even though she was 5'4" and 120 pounds, which is completely average. She felt like she was too fat. So she used laxatives, thyroid medications, and ipecac syrup to speed up food evacuation and to increase her metabolism. So in September of 1982, she was hospitalized for anorexia. She was already in her 30s. This is her on the left at a completely normal weight. She had anorexia and bulimia for so long that she had already developed heart failure. Now, back in 82, anorexia and bulimia weren't well known. When people would say, I've got this eating disorder, not a lot of people knew what this meant. But she was discharged from the hospital for heart failure. She went to go live with her parents in Downey, California. And on February 4th, 1983, she came downstairs and had breakfast with her family, her mom and dad, and they were going over today's plans. Okay, what we're going to do today, And she had these plans, she had these errands she had to run. And so she ran back upstairs to her bedroom and didn't come down when her mom thought she should have been coming down to run her errands. So her mom went up there, and based on the accounts, it was either like a walk-in closet or a dressing room. Just depends on your interpretation of this, but she was found on the floor by her mother in her walk-in closet dressing room with a heart rate of 6. So mom called EMS. EMS arrived. They found her agonal heart rate of 6. They went ahead and did all the resuscitation measures they could. They went ahead and transported her to Downey Memorial, and she was pronounced dead at 9:51 at the age of 32. So I remember when she died, it was a huge thing. I mean, it's all over the news, and everyone's like, oh, she died of starvation. She died of that disease she has, that eating disorder she has. And that's what we believed for, like 3 years. And then the results started coming back. She didn't directly die from the eating disorder. She died from Imatine cardiotoxicity. Well, again, what's that? Okay. So Imatine cardiotoxicity is a side effect of taking ipecac syrup. Remember, that was part of the reason why she was losing weight, was she was taking ipecac. Now, if you're old enough to remember what ipecac was, a little brown bottle. Every household in America was supposed to have had one. American Academy of Pediatrics advised every household with children needs to have a little bottle of this in there, so that in case your kid gets a hold of some pills or something, you can have them drink the little brown bottle and it will make them puke, like severely puke. I've only had to give it once in my career, and it will make you puke your toenails up. I mean, you gag and you retch and you retch and you retch. That's how she did it to get rid of the food she'd just eaten. But with Emmetine, Emmetine is a byproduct of chronic ipecac syrup ingestion. So you drink the ipecac, it does get in your system, it does make you puke, but as your body breaks it down and metabolizes it, it creates Emmetine. And Emmetine is not well excreted from the body. It just kind of persists, it builds up, and it is extremely toxic to your heart muscle. So because of that, now ipecac syrup is no longer available. They stopped production in 2006. You can Google ipecac syrup, like on Amazon, and you'll come up with some homeopathic similarities, but you will not find ipecac syrup anywhere else unless you go to one of these old mom and pop stores in the rural states where you live, and they may have a bottle that's on the shelf since from the 80s that's well expired. That's the only way you're going to find this stuff. So at the end of every case, I will ask you this question: could she have been saved today, or could he have been saved today? And I'm not asking for philosophically, could we have saved them? Because philosophically, yes, we could have gotten her to better counseling. We could have gotten her into nutrition. We could have done a bunch of stuff, possibly. But what I'm talking about is, if you were to roll upon this case today in your rig, could you have saved her today in 2023? Okay. So I ask you guys, could we have saved Karen Carpenter if we had pulled up on her and she has a heart rate of 6 and she has agonal respirations and Emmetine toxicity? Probably not. She was just too far gone. You know, I don't know how long they coded her, but obviously they were able to keep her going until they got to Downey Memorial. She was too far gone. She had too many systemic things wrong. So in December of 1799, George Washington died of a sore throat. Who dies of a sore throat, even in 1799? Now, some scholars went back to the reports and said, oh, well, he probably had strep throat, or he had a peritonsillar abscess. But again, who died of strep throat in 1799? And peritonsillar abscess, they don't get big enough to cause death. So, you know, everyone's wondering what the heck happened. Well, what happened prior to this was the day before he died. The day before, a big storm was coming in to Mount Vernon, which was his plantation. And so he and his slaves and his house servants were preparing for the storm. They were bringing in wood. They were making sure they had everything they needed. General Washington got on his horse and rode the property to make sure everything was buttoned up, the animals were taken care of, his slaves were taken care of, we have plenty of everything we need. And in the process, he got wet because it was starting to storm. So he got wet, he was cold. Of course, back then you wore, wool and cotton, and so that was holding that moisture up against him. He got back to the house and he was so hungry, he didn't want to wait and get out of his wet things. He just wanted to sit down and eat. And I'm sure Miss Martha was fussing over him. You got to get out of these. You're going to get the death of cold. And he's like, I'm starving. I'm hangry. Let me eat. So he ate supper. And then, yes, he went upstairs and he got out of his wet things and got into some dry clothes. Well, that next day, he woke up with a sore throat. And again, I'm sure Miss Martha's like, I told you so. But anyway, so they called in the personal physician, very good friend of his, and they did the treatment at the time. So they did bloodletting, which is nicking a vein in your arm and letting the blood drain to get rid of some bad blood. It was estimated he probably lost about 5 pints from all the bloodletting that they did. They made a mixture of molasses, vinegar, and melted butter and had him gargle that and then swallow it to coat your throat to make it better. And then they made this poultice and this salve with crushed dung beetles and herbs and spices, and they slathered his neck with it and wrapped his neck in a warm wool scarf in hopes that this would cure him of that really bad sore throat. Right before he died, and his personal physician was there, Martha was there, and his favorite house servants and slaves were right there at his bedside. There was an account of like 6 to 10 people who watched this, and they all said the same thing. He had a sudden onset of spiking fever. He had a muffled voice. He couldn't swallow his own spit, so he was having to lean over and let it roll out of his mouth. And then he was dead within minutes of unable to swallow his own spit. So what happened? That doesn't sound like strep throat. Doesn't sound like peritonsillar abscess. Well, they figured out that most likely he died of epiglottitis. So there are the 4 D's of epiglottitis: drooling, dyspnea, dysphonia, dysphagia. Drooling we get. His epiglottis has swollen so much that he can't swallow his own spit. Okay. Dyspnea, trouble breathing. Yes, you've got an upper airway problem. Dysphonia is the fancy word for muffled speech. We can also call it hot potato voice. And you can chart that. That's kind of a legal term. It's where your vocal cords can't come together and phonate, but you can still talk. So they talk like this. Okay, it's as if you put a piece of hot potato in there and you're like, oh, it's hot, it's hot. Okay, that's called hot potato voice. The technical term for it is dysphonia, and that's what he had. Yes, his epiglottis was so swollen he couldn't get his vocal cords together. And then dysphagia, again, he can't swallow. Okay. So could he have been saved today? If you were called to Mount Vernon and you went up to his bedroom and saw him with a sudden spike in fever, dysphonia, dysphagia, drooling, probably sitting straight up if he could you have saved him? Yeah, most likely. If you're BLS, you could have tried to get down an adjunct airway to maybe bypass that. If you're ALS, you could have tried to intubate him. If he was way too far gone, you could have criked him. If you had gotten there soon enough and got him to the hospital, they would have given him antibiotics and cold mist treatments, and that would have taken down that inflammation and infection. He would have been fine. Princess Diana, in August of 1997, she and 3 other people were speeding down the streets of Paris in a Mercedes-Benz at about 65 to 70 miles per hour. I have converted all this from metric to standard, so we can all kind of convert this. So it was 65 miles per hour. She was in the back passenger seat, even though this was a Mercedes-Benz. The driver's side was our driver's side, so yes, it was on the left, but she was on the back seat passenger side. None of the occupants were initially wearing their seatbelts. Okay, so this is the actual car she was in. You can see here, Henri Paul was the driver, no seatbelt. Dodi Al-Fayyad behind him was her boyfriend, no seatbelt. Trevor Reese Jones was her bodyguard, and he was in the front because all bodyguards sit in the front, and then Princess Diana was right behind him. Now, the reason why Trevor Reese Jones wasn't wearing a seatbelt was because in Europe, bodyguards aren't allowed to wear seatbelts. Seatbelts restrict them from being able to turn quickly and save their person. So in Europe, they're not allowed to wear them. So he had an excuse. However, the last traffic cam that caught them before they went into the underpass, Trevor was wearing his seatbelt. The driver was drunk, he was speeding, he was trying to get away from paparazzi, and so Trevor had the presence of mind to put a seatbelt on. So this is a reconstruction of what happened here. This is 65 miles per hour when they hit that pylon there. So this is the actual car. Paparazzi saw it all, and they were trying to catch her. And so they were first on scene. They got up to her window, and they're snapping pictures of her through the window. And she was alive. She was talking. They testified that her last words were, "Please don't, please don't, please don't." She just wanted some privacy, and they kept on snapping pictures. So EMS and fire get there. There's substantial damage to the front half of the vehicle. Airbags were deployed. Diana had no visible injuries from where she was sitting. She was in shock, but she was still talking. So she did have a laceration on her thigh, and she had a broken arm and some bruised ribs that were the minor portion of her injuries. But other than that, they didn't see anything that was really, really bad wrong with her. So EMS and fire got her extricated, but once she was extricated and they laid her flat on the board, she went into cardiac arrest. So they worked her. They got ROSC, so they were able to transport her to the hospital. She was in the OR for 2 hours, so she stayed alive. They poured blood into her. They had massive internal bleeding. What she had was a massive chest injury, and her heart was displaced to the right. So instead of your heart sitting like this, it was over here like this. So the two veins that come off your heart to go back and forth to the lungs, you know, your pulmonary veins, okay? Her heart was like this. When it went like this, it tore the back side of a pulmonary vein. And that's where she was continuously pumping blood into her chest cavity. Now, Dr. Richard Shepard is a leading forensic pathologist, world renowned. He was not on her autopsy case. However, he was asked to look at the report. So he never saw her autopsy. He saw the pictures. He saw all this other stuff. And he was quoted as saying, had she been restrained, she probably would have appeared in public 2 days later with a black eye, perhaps a bit breathless from fractured ribs, and with a broken arm and a sling. So could she have been saved today? No. That tear in the pulmonary vein, they never did find it until after the autopsy. You know, they knew she was bleeding from somewhere. We don't do that. We don't go to exploratory, you know. They were able to get her back. They got her in the OR, and even in the OR for 2 hours, the surgeons could not fix her. Now, philosophically speaking, could she have been saved today if she'd been worn her seatbelt? Absolutely. Absolutely. John Ritter, who's one of my favorite actors, on September 11th, 2003, he was filming his current TV show, which was 8 Simple Rules for Dating My Teenage Daughter. So this is in Burbank, California. They're filming, and he starts to feel a little sick. And everyone who knew him, I mean, even after his death, people who weren't even there on this TV set but had worked with him in the past had said, he's not a whiner. He would work through the flu. He worked through all kinds of stuff. For him to say he didn't feel good and go to his dressing room and shut the door, not like him at all. But he did feel sick. He had nausea, vomiting, diaphoresis, and beginning of some chest pain. So finally at 6 p.m., some of his coworkers were like, you got to go to the ER. This is not like you. Something's got to be wrong. So ironically, the ER is right across the road from the studio. So they took him across the road to the ER in the same hospital that he was born in. That's where he died. So he went to the ER. Of course, what do you think when you're hearing chest pain, vomiting, diaphoresis? We're thinking heart attack. Absolutely. STEMI. EKG was normal. Okay, well, maybe it's a non-STEMI. Labs were normal. Chest x-rays normal. So back in 2003, you gave aspirin, oxygen, morphine, nitro, and heparin. That's what you gave for what you suspected was heart attack. So while they're doing all this, he's just not feeling good at all, and he's not looking good. So they go over the sample history, and so they ask him, you know, do you have a family history of cardiac disease? And he's like, well, I mean, my dad died in 1974 when he was 68 of a heart attack. His dad was the famous Tex Ritter. If you're not old enough to know that, he is a famous cowboy poet singer from the 50s. So his dad died at the age of 68. So we're like, okay, this guy's in his 50s. His dad died at a young age too. You know, he's got a family history of cardiac disease, obviously. What John had was an aneurysm. They finally realized maybe we need to do some more surgery because they kept on repeating labs, repeating chest x-rays, nothing. So they took him to CT, and they found that he had an aneurysm that was dissecting, and they had to get him to OR quick. They got him to OR, and they think that he knew that he was going to die because he was happy, he was smiling, he's like, you know, bye guys, love you, you know, but they're pretty sure that he knew he was going to die. So he was on the OR table for a little while before his aneurysm actually completely dissected and ruptured. So an aorta, the picture on the right, is the largest artery in your body. It comes off the top part of your heart where your left ventricle pushes blood hard and fast up into the ascending aorta. It has to be hard and fast enough to be able to make the loop over your aortic arch, and then it's sent down into your descending aorta where it feeds the rest of your body the oxygenated blood. So an aneurysm occurs when you have an equal dilation of all 3 tissue layers in your aorta. There's 3 tissue layers. There's the tunica intima, the tunica media, and the tunica adventitia. So 3 strong layers of tissue that's keeping your aorta intact. If you have an aneurysm, those 3 layers get weakened equally. They're still intact, but they get weakened equally and they bulge out like that. Now you can live with an aneurysm. People do all the time. People walk around saying, I have an aneurysm, and that's fine. As long as your aneurysm stays small enough and doesn't grow at a very fast rate, yes, you can have an aneurysm. What happens though is if your aneurysm starts to dissect. Now you see here on the picture on the right, that little arrow going through the tunica intima. Well, remember there's blood pushing through that aorta with every beat of the heart. If you've got a tiny little tear in there, blood will push through there and will surge into your tunica media and will start creating this false lumen. And now it's tearing through 2 layers. Well, the tunica adventitia, which is your gray layer right there, it's the strongest, but if it starts tearing and it ruptures, you've got a 90% mortality rate. So risk factors for having an aneurysm or a dissection is being male, having chronic untreated hypertension, smoker, over the age of 65, obesity, COPD, Caucasian, have any kind of connective tissue genetic problems like Ehlers-Danlos or Marfan syndrome, trauma to the chest, and weightlifters. Like I'm talking about the really massive weightlifters who bench press their weight. Okay, not just a couple of 20-pound curls. I'm talking about major weightlifting. So for anyone who tells me as part of their sample history, whether it's a sore throat or a stub toe, I don't care. If I ask what's your medical history and they say have an aneurysm, I want to know where's the location. If it's above your renal arteries, it's in the chest or the thoracic. Okay. If it's below your renal arteries, it's in the abdominal. So I want to know where the location is. How big is it? Anyone with an aneurysm will know this answer. Okay, let's say, oh, it's 3 centimeters. Okay, as long as that aneurysm is less than 5 centimeters in diameter at the widest portion of that aneurysm, we're doing okay. The rate at which it ruptures or dissects is very low, as long as it's less than 5 centimeters. Now, how fast has it grown is my next question. When's the last time you had it checked? Anyone with an aneurysm will get a CT every 6 months for the rest of their life. Because if that aneurysm, no matter how small it is, if it grows more than half a centimeter in 6 months, they're going to go to surgery. So how fast it grows or just how big is it overall is what we're needing to know. So you can live with an aneurysm. You can have an aneurysm and not have a problem. You can also dissect your aorta without an aneurysm. If those walls get lacerated or torn open for some reason, it will go ahead and rupture also. So the terms are interchangeable, but you have to make sure you know dissection versus rupture. An aneurysm you can live with until it gets too big or grows too fast, okay? So if you suspect you have somebody with an aortic dissection or an aortic rupture, we're going to lower their blood pressure to a MAP of 70. We want to lower it however you can. Nitrosublingual every 2 or 3 minutes, nipride, cardine, whatever you can give them that will lower their pressure. We give beta blockers to get their heart rate down to 60. And then we give them pain control. Morphine's great because morphine will also lower your blood pressure. And then surgery, maybe. Now, there used to be the classification of the DeBakey aneurysms and dissections. So people go, oh, it's a DeBakey 1 or a DeBakey 2. Well, they don't use DeBakey classifications anymore. They use what they call the Stanford. So you have a Stanford A, Stanford B. If you have a Stanford A dissection, your aneurysm or your dissection will be at the aortic root or along the arch somewhere. And that's really the point at which your aorta takes the most work. It takes the most brunt. So if you have a type A dissection, you will be going to surgery. 50% mortality if you do not get surgery in the first 48 hours. Now, if you have a Stanford B dissection, this is what I learned recently and it blew my mind. If you have a Stanford B, they send you home on antihypertensives. That's it. Now, you can see on the diagram, the Stanford B is anything along the descending aorta. So most of the workload, that pressure, has already decreased quite a bit. It's on the downhill slope, so you've got gravity helping you. If your dissection is on that back side, it's called a type B. You're sent home on antihypertensives, no strenuous exercise, no strenuous work, and they just watch it. Now, you can have what's called a complicated type B, but that's if you've got a bunch of other problems going on, like you're diabetic, or you've got connective tissue disease or coagulopathies, a bunch of other stuff that would come with it. The doc's like, I don't think bed rest and antihypertensives is going to be enough for this guy. One of the ways you can work with this is a TEVAR, which is a thoracic endovascular aortic repair. It is a Dacron sleeve that is embedded with little wires. Those little gray zigzags on there, that's actually wires, like a 24 gauge wire that's bendable, but it's got some bounce to it. So it's embedded in there so it keeps its shape. They thread a catheter up there, they release this sleeve, and it's tacked into place. And then the aneurysm itself on the far right, it just becomes dormant. The blood that's trapped in there will break down and get reabsorbed by the body, no problem. But that Dacron sleeve now has replaced that aneurysm, and if it ruptures, that Dacron sleeve is there to keep everything intact. So after John's death, his wife, Amy Yazbek, wanted answers. Why did it take you so long to realize he had a dissection? And she had to educate herself on this stuff because she's not in the medical world. And so she and a bunch of doctors got together and tried to figure this out. So she created Ritter's rules. And you can Google this. This is being taught now in all medical schools in America, because she doesn't want someone else to die unnecessarily because they didn't recognize that this was an aneurysm. So some of the rules are urgency. Once you decide it's a dissection, you must go get it fixed. They will be in pain, not like heart attack pain where most people go, oh, it's pressure, it's thumping, it's this. This pain is extreme pain, stabbing, tearing, ripping. People who have heart attacks don't say it's tearing or it's ripping or it's stabbing. These people will present just like an MI. Chest pain, nausea, vomiting, diaphoresis. Okay. First thing we're going to think of 70% of the time is STEMI, and we're right. The EKG will come back positive or the labs will come back positive. But this is different. So what she has pushed is if somebody comes in with these signs and symptoms and you think it's a heart attack, but everything's coming back negative, EKG is negative, labs are negative, can't figure this out, but they still look like crap, go to CT or MRI or transesophageal echo. They will catch it. Chest x-rays will not catch an aneurysm. And that's what happened to him. They kept on doing this over and over and over again. Chest x-rays, labs, blah, 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 nothing. CT is what caught it. So family history is a biggie with Ritter's rules because she learned that this is a family history. And she's like, well, my father-in-law died in 1974 of what they said was a heart attack. He had stabbing chest pain and he fell down and he was dead. No autopsy was done. You just thought, okay, they had a heart attack, they're dead. So they went back through everything and they decided to do some genetic testing on John's brother, Tom, who's just a couple years younger than he is. Tom had an aneurysm. So they are thinking Tex Ritter, their father, probably had an aneurysm, had chest pain, nausea, vomiting, diaphoresis, died. John had it, he died. Tom had it, he went to surgery. He's got it fixed. So now all of John and Tom's kids are getting routine CAT scans because it's not if they develop an aneurysm, it's when. So they're being monitored very closely. So I've learned with my job, after learning this, that if I have a patient who has all these signs and symptoms, my EKG is normal, could still be a non-STEMI, but if I find out later on that their labs are normal, I want to know, did your mom, dad, sister, or brother ever have a heart attack? How old were they when they had the heart attack? Or do you have family members that you know have an aneurysm? Because I came across one, he's like, yeah, my mom died of an aneurysm. Okay, then that means he will probably have one too. So any kind of triggers like extreme straining, hypertension, illicit drug use like cocaine that'll make your heart pound in your chest and your blood pressure go up. Prevention, controlling hypertension, proactive imaging if you know you're at risk, and then getting genetic counseling. So could John have been saved today? Most likely, yeah. I don't know how long he laid in that ER before they finally did the CT scan. It might have been an hour, it might have been 6 hours. I don't know. But now I see in ERs, at least in Kansas City, Missouri, which is the biggest city that I go to, in a lot of those big HCA hospitals, there's a sign somewhere in there reminding doctors, you know, EKG normal, labs normal, consider a CAT scan. It's a prompt. If everything's coming back normal, but they look like crap, let's get a CT or an MRI. So yes, he could have been saved today if they had been a little speedier with the CAT scan and got him to OR quicker. Joan Rivers, in September 4th, 2014, she was scheduled for an elective outpatient laryngoscopy. She was a comedian from the 50s and 60s. Her voice was her life. I mean, that was her bread and butter, so she had to take very good care of her voice. So she had these polyps on her vocal cords that she was going to go get removed. Now, this is a freestanding outpatient center. This isn't part of the hospital. This isn't a medical clinic. It's a freestanding building where you go and get your outpatient procedures and then you go home, no big deal. So they put her in there, they gave her conscious sedation, and she developed laryngospasms. The staff failed to identify deteriorating vital signs and to provide timely intervention was exactly how the death report went. Now, I know that they said she did not have adequate monitoring equipment. I don't know what that means. I don't know if she didn't have a cardiac monitor or if she didn't have capnography. I don't know, but it was inadequate monitoring equipment is all I can say for a fact, okay? And then she died of a hypoxic encephalopathy because she had those laryngospasms that they couldn't intubate through. Now, there was one doctor in the building who was able to do a cric, and he heard that Joan Rivers was in trouble and they needed him down there, and he ran out the back door of the building in order to keep his name from being put on this record. So I've got the names in my speaker's notes. One was Cora Van, but I don't know if that was the good guy or the bad guy. But anyway, yeah, the one doctor ran out the back door of the building. So laryngospasms on the left are beautiful, gorgeous vocal cords. And you can see beyond that the tracheal rings, okay? A laryngospasm happens when we irritate the larynx, the vocal cord and the airway, basically, enough to where they will snap shut. So when your vocal cords snap shut, you can't breathe. So there's a couple different things we can do. And we were always taught this when we were doing intubating. And this is a BLS skill, so hang on here, okay? We in ALS were taught, okay, when you're in there with the laryngoscope blade and you see laryngospasms, you can get topical lidocaine, which is, we call it Lidojet. I don't know what the generic name is, but spray a little lidocaine on there, wait a few seconds, and okay, longest few seconds of your life. The other thing is just wait. They're like, okay, just hang on a second. In several seconds, it will eventually relax enough to where you can pass that tube. Again, longest few seconds of your life. Pressure points. There are two different ways of doing this, okay? One, thump the voice box hard, okay? Don't smack it, thump it, okay? Thump it really good, and that should do it. If it doesn't, there is a guaranteed way, and it's pressure points. So underneath your jaw is this muscle called the digastric muscle. I know that means two stomachs in Latin. I don't know why that muscle is called that up here, but that's what it's called, the digastric muscle, okay? So everybody, put your fingers right here on the corner of your jaw, just like this lady, okay? Do it to yourself, not your neighbor yet, okay? So once you find that, slide your fingers down and press in on that soft tissue like that, hard and fast, okay? If you do it right, it'll hurt and it'll make you choke or gag, okay? So corner of the jaw, down, and then hard and fast. If you want to, you can do it to your neighbor now, if you want to, okay? what happens there is that pressure point that you just hit that made you go, right? It is actually the same nerve that powers this. So when you hit that, that pressure point goes ping, and the vocal cords splay open, and your partner's like, yay! So next time this happens, ALS people, tell them, I've got laryngospasms, don't move, just stay right there, okay? BLS people or the partners of the ALS people, if you're a double ALS truck, do your little trick there, okay? Just kind of reach around them, do that, and you'll be able to pass that tube. So could Joan have been saved today? Absolutely. Proper monitoring equipment for one, okay? Somebody who's trained in ACLS and intubation and crike, who stayed in the building, absolutely. Based on the reports were a little bit vague because a lot of this is protected information because her daughter Melissa settled out of court for an undisclosed amount. So from what I could get, I got the impression that she probably didn't even need to go that far. They just needed to monitor her a little bit better and catch it a little bit quicker. The doctor who was there in charge of her airway had put in his notes beforehand that he didn't feel like this was a safe enough procedure because she already had a little bit of swelling going on. Dale Earnhardt, February 18th, 2001, Daytona International Speedway. At that time, there was some non-mandatory safety equipment that he would not wear because it affected his ability to race. He was known as the Intimidator. He could turn both sides and he could rub just enough somebody else's car and it would send them off. Okay, so he was called the Intimidator for a reason. He didn't like them. He said, it held him in place where he couldn't do anything but drive. He couldn't turn his head. He couldn't do anything. He said, I can't do my signature move if you're making me wear all this stuff. So here he is, the number 3 car is what you're looking at. It doesn't look too bad at this point, but he hit at such a rate that he was dead instantly. So I'll let you see it one more time here. So he died on impact at turn 4 of the racetrack. He was going about 160 miles per hour. It was true death at impact because he had what we call an internal decapitation. So his autopsy findings, what killed him was the internal decapitation was actually a ring fracture at the base of the skull. So you've got C1 and C2, and then your head sits right here. It snapped forward and broke all the bones along C1 and C2 at the base of your skull, okay? He had a basilar skull fracture. He had a subarachnoid hemorrhage, an epidural bleed, left temporal fractures, fractured left ribs, and abundant blood in the external auditory canals. So I'm going to keep talking while I plug in my computer because it's about to die. But basilar skull fracture happens when you get a crack in the back of your skull, okay? It is commonly involved with the temporal bone. And I mentioned that he had a left temporal fracture. What you're going to see with those patients who have basilar skull fracture is they're going to have battle signs. Okay, so they're going to have bruising behind the earlobes. They're going to have raccoon's eyes, cerebral spinal fluid from the nose and the ears, facial numbness if they can talk anymore, and then they're going to have crossed eyes, vomiting, and trouble hearing. So if anyone remembers halo sign, what we did was if we suspected a head injury and they had clear stuff coming out of their nose or their ears, we had to test it to make sure it wasn't snot or tears. Because if you think about it, if you're laying flat on your back like this, and I've seen it before, people are crying because they're hurting. Tears will run down by gravity and pool right there. So what you're looking at was tears. So we had to figure out, is this cerebral spinal fluid or is it tears? If you got something thin and watery coming out of your nose, is it runny snot or is it cerebral spinal fluid? So what we were taught to do was to get a 4x4 gauze and dab at the liquid and then set it over to the side and let it dry. And if it dried into this halo sign, which is what you see here, then it's positive for glucose, which is only found in cerebrospinal fluid. You don't have glucose in your snot, you don't have glucose in your tears. So we're like, oh, positive halo sign. Well, we're not allowed to do that anymore. You can do it, but don't chart it, okay? Scientists found that saline, tap water, and runny snot will all produce a positive halo sign. So there's really no way that we can test for it unless we want to do a glucose test on it with our glucometers. So if you have runny snot, you can take your glucometer and see if it's positive for sugar. If so, then you can suspect it's cerebrospinal fluid. Don't chart halo sign. Don't give report as having halo sign, because that is a big no-no. It's not accurate anymore. And so lawyers would love to just tear you up for using that antiquated term. So since Dale died, they made the initial non-mandatory safety equipment mandatory. It's called the Hans device, head and neck support. So you can see here, you've got your helmet and you've got a collar that is clipped onto your shoulder, and then your helmet's clipped onto the collar, and the collar's clipped onto the seat. So that way, when you get thrown forward, everything catches. Because remember, Dale's head went absolutely forward, snapped, and then came back, and he was internally decapitated. This device has saved many, many, many major name NASCAR drivers since Dale's death. Here's a picture of the current Hans device, and this was a courtesy of Sean and Shane Merrill from Lake Ozark, Missouri. I gave this presentation, and they were both race car drivers, and they're like, you got to see this. So this one is easier because my first Hans device exposure, they had a special tool that you could not remove the Hans without the special tool. It looked kind of like an Allen wrench, but it wasn't. And I had a guy who had the full face helmet. Well, if he has an airway issue, I need that thing off. No one could find the tool. So they have since improved it to have quick release buckles. And then they have a simple piece on here on the top left. You can see a screwdriver or a flat knife will take care of that quick release for us. They've also instituted safer barriers, steel and foam energy reduction barriers. And that's on every NASCAR track in America. No Cup Series driver has died during competition since then because of these two things that they've put into place. So Dale could he have been saved today? He had an internal decapitation and a ring fracture and a subarachnoid bleed and an epidural bleed. He was dead on impact. There was nothing we could have done. They did an amazing job. I read the autopsy report. I read part of the ER report. I mean, they did everything they could. I don't think I would have done anything differently. He still died. So. Christopher Reeve, his most famous role was for Superman, but he was in a lot of other really great stuff. He was very athletic. He ran, he worked out, he did horseback riding. He was just a really athletic guy. And on May 27th, 1995, he was horseback riding in Virginia and jumping hedges in a competition, and he was thrown from his horse. So he was riding his horse, and the horse stopped short of the hedge, and Christopher Reeve went head over heels over the hedge, landed on the other side, head first. Remember that C1, C2 that I showed you, where your head sits here? He absolutely shattered it. He didn't just fracture his C1, C2, he shattered it. EMS is doing standby for this event anyway. They get there a minute later, he's not breathing. He can't breathe. So he's in respiratory arrest. They begin ventilating him. So what he had was a hangman's fracture. This can also happen for hanging victims. So Atlas and Axis are in Greek mythology. So you can see here the guy holding the weight of the world, that's Atlas and Axis. And your skull is the weight of the world on your shoulders. So that's why they call it Atlas and Axis. With hangman's fracture, you'll have swelling around the neck, pain, difficulty or inability to breathe, tingling or sensation below the level of injury, and then loss of bowel and bladder function, which is most likely what he had also. So they gave him respiratory management and sent him to the hospital where he was diagnosed with hangman's fracture. And he was given the option. They're like, you're going to be a quad for the rest of your life. You will be ventilator dependent. you will have to have 24/7 care, whether it's in a nursing home or if you want to pay somebody to come to your home. There's nothing else that they could do. So he and his wife talked about it, and he's like, I want to live. So they trached him. He had quadriplegia, and he lived in a wheelchair for another 9 years. He was on a ventilator. He was very big on rehab. I mean, he was a fighter. So he was like, I want stem cell research. I want rehab. I want all this stuff. I want to see if I can walk again. And so one of the first things they said is, you can't do anything until we get you off this vent. So he tried and tried and tried to get off that vent. When they did take the vent off, he tried his best to take a deep breath on his own, and his tidal volume was 6 milliliters. 6 milliliters. Okay. A newborn's tidal volume is 30. So he was breathing about a teaspoon of air. That's the best he could do. They put him back on there, and he just had to be on a vent for the rest of his life. So being wheelchair dependent, he was at risk for developing decubitus ulcers. And yes, he had a decubitus ulcer on his lower back or his butt, and it got infected, and he developed sepsis. Now, he had a 24/7 healthcare team in his home. He could afford that. Best of the best, doctors, nurses, rehab, everybody. He had a team there 24/7. So he didn't have to go to the hospital. You know, doc looked at it, said, yes, it's infected. Let's give you some antibiotics. They gave him antibiotics, and he developed an anaphylactic reaction. You see, he was allergic to a lot of stuff. As healthy as he was in his younger life, he had a lot of allergies. He had a lot of health problems, you know, like sickly kids type stuff that carried into his adulthood. And so he developed an anaphylactic reaction. They went ahead and loaded him up, took him to Westchester Hospital, and he died 18 hours later of heart failure and anaphylaxis. Now, in anaphylaxis, you have swelling to the airway, yes, but that's not an issue because he's got a trach, so that wasn't the issue. Excess salivation, watery eyes, runny nose, and that's from your 2 different histamine types, profound hypotension. So he already had sepsis. They were working with that. Then he gets anaphylaxis, which none of this stuff would have killed him in this case, except for the profound hypotension, which put tax on his heart. He's not getting any perfusion. And so that's what he died of. Could Christopher Reeve have been saved today? Probably not. I mean, it wasn't that long ago this happened. Everything that I saw in the reports seemed very, very appropriate even today. You know, we may have been able to get him back and keep him alive for a couple more days. I mean, he lived for 18 more hours, but he was a sick man. Quadriplegia is not something that's easily managed. You know, you got a lot of upkeep with that. So Heather O'Rourke, if you remember Poltergeist, they're back. She was the star on this show. She, in January 30th, 1988, she was a healthy, happy kid, playing outside, doing whatever. They were in California, so it was mild weather. January 31st, her mom remembers she developed flu-like symptoms. Stomach bug, nausea, vomiting, diarrhea, you know, a little bloated belly, you know, tender belly type thing. You know, we've all had that. On February 1st, the next day, her condition deteriorated to the point where mom called 911. EMS got there and had to resuscitate her. They got ROSC and took her to the nearest hospital, which is a small community hospital in El Cajon, California. So that doctor stabilized her and said, we got to get her out of here. I mean, it's a community hospital. So they took her to Children's Hospital in San Diego, which was the biggest and the best children's hospital in the area. It was fairly close. Heather was taken directly to OR, and they did an exploratory bowel surgery on her and found the reason why she got so sick so fast. Her intestines had ruptured. So her intestines ruptured, spilled all the poop out into her belly, where it grew and developed into sepsis over the course of just a couple of hours. You know, she had stomach flu on January 31st, February 1st, she's not doing good at all, and they had to code her. She survived surgery. They got her to recovery, and she coded again after they'd done a washout and antibiotics and all this stuff. They're like, she was so far gone. So with the sample history, the doctor's trying to figure out, why does this healthy little girl, I think she was about 10 or 12 at the time, why is this healthy little girl, why did she die of sepsis? This was a simple stomach bug thing, we think. Well, going back, mom says, well, she was diagnosed with a waterborne illness in 1987, just a year prior. They went up to their cabin in the mountains and she drank some tainted well water, got some intestinal bug. She was given antibiotics for it and she got over it. She was diagnosed with Crohn's disease when she was smaller because she'd always had stomach troubles, diarrhea, constipation sometime at the same time. Ever since she was like 2 or 3 years old, they just said, well, she's probably got Crohn's disease. Okay. This is her actual death certificate. And if you know how to read a death certificate, they always start with a primary cause, as related to the secondary cause, as related to the third cause, and then any other notes. Okay, so she died of cardiorespiratory arrest, about 30 minutes in duration, after having suspected septic shock for about 6 hours. She then died. The direct result was an acute bowel obstruction that she had had for about 36 hours. And then down there on the notes, stenosis of the small intestine. That doesn't sound like something that you'd get from a stomach bug. Stenosis of the small intestine. Okay, so mom wanted heads to roll. Her baby girl was dead. And so she wanted to sue, she wanted to do everything. So they did the autopsy, and the suit was eventually dropped because they found out she had a birth defect that nobody had detected. She had stenosis of the small bowel, which we know now. What happens is in the small bowel, the lumen just gets narrower, not completely closed off, just narrow enough to where food doesn't pass through very easily. Now, hers wasn't too bad because usually these are caught at about 2 to 3 years of age, right? When babies are starting to eat real table food. Because at babies, they're either breastfed or bottle fed, and it's all liquid. So yeah, that liquid can go through there, okay? When you're about 2 or 3, that's when you're really starting to eat what everybody else eats at the table. And so that's when they start finding this, is when the stools get more solid. What you see with intestinal stenosis is intermittent crampy abdominal pain, loss of appetite, constipation, and diarrhea sometimes at the same time, cannot poop, no gas, and then their bellies get big. Heather's wasn't bad enough that she had this. Now remember, she was diagnosed with Crohn's disease when she was about 3 because she had all of this. Well, no one scopes a 3-year-old. So they're like, well, mom, you probably got a family history of this. This is what's going on. It's easily treated. We'll just monitor her. So could Heather have been saved today? If we had arrived there and she had already had her bowels cooking in her belly for 12 hours, no. She already had multiple organ dysfunction syndrome. She probably had high abdominal pressures. She was too far gone. I'm going to do one more here. Abe Lincoln. I know, gunshot wound, but listen up here, okay? April 14th, 1865 at 10:15 p.m., Lincoln and his wife were in the box seats at Ford's Theater in Washington, D.C., and he was shot with a .44 caliber Derringer from here to here, okay, so this way. The bullet entered the back of his skull and stopped just after it severed his left cranial artery. It's still in there, no exit wound. So down in the pits, there was a new doctor, Dr. Charles Leal. He was there. He heard, we need help, so he ran up there. He had been at a medical school for 2 whole weeks. This was his first patient. So he runs to Lincoln's side. Lincoln slumped over, and he's like, he's got mortal wounds. They couldn't detect a radial pulse. He was struggling to breathe agonally. It's mortal wounds. So you can't have a president dying right there in Ford's Theater. So they gathered up a bunch of the guys, and they carried him across the street to the Peterson House, which is a boarding house right across the road. So here's the path of Lincoln's gunshot wound. Okay, remember the bullet was not, it's not an exit wound. The bullet is still in there. So they took him to Peterson's house, and they put him in the bed crossways, diagonally, because he was so tall. But things that we need to consider nowadays, caliber, velocity, distance from the gun to the patient. Was it close range? Was it far? The path the bullet took, in this case, through the brain and skull. I mean, is it through the belly? Is it through the leg? Then we have to think long-term, meaning hours from now, secondary swelling and ICP. Now back to Lincoln. He's in the bed in the second story of Peterson House, and the doctors are there, and they're repeatedly probing his wound to try to get that bullet out with their non-gloved hands, because gloves didn't exist back then. So they're putting their booger-picking fingers into this wound, trying to pull out stuff. Now, they did notice that his condition would deteriorate, and if they'd start pulling out the clots, his condition improved. So every few minutes, his condition would deteriorate. He'd get unequal pupils, his breathing would become erratic, his heart rate would become erratic. So let's pull out some more clots. They estimate that he probably died of cerebral herniation and massive hemorrhage, rather than just saying gunshot wound to the head. Now, anyone who has cerebral herniation, you're going to have an alteration in LOC until you become unresponsive. You're going to have an irregular heart rate and respirations with a widening pulse pressure. That's the distance between your systolic and your diastolic. Okay, so if I have 120/70 and then 123/68, well, yeah, that's a widening pulse pressure. But in cerebral herniation, I'm talking about 120/70, 123/68, 240/30. That's a widening pulse pressure you're going to see with cerebral herniation. And then, of course, posturing, depending on where in the brain this herniation is happening. So how can we help this? In EMS, we keep their head midline, okay? We don't let their head go to one side or the other because these veins are brain drains. We don't want to kink this off. So keep their head midline, elevate their head to about 45 degrees. The only people ever in hospitals who have to lay flat are those with recent spinal taps, epidurals, some brain drains like cerebral shunts. Otherwise, all patients are going to be sitting up about 30 to 45 degrees, all patients. We don't overheat them. We don't give them hypotonic fluids like D5 because that'll just make your brain swell more. And then we're not going to allow them to strain or gag. So 9 hours later, April 15th at 7:22, Lincoln took his last breath. So could he have been saved today? Well, this is interesting because that very question has been asked of scholars and historians for 100 years now, probably over 100 years. With today's modern medicine, they are able to answer that question. Yes, he could have. If he was shot today, we could have saved him. And some people say that he would have still been able to be president. Others are like, that's pushing it. Others are like, no, he would have been fine. He could have fed himself, wiped his own butt, given himself a shower and stuff. He would have had some problems with speech or communication, but he could have been a functioning person in society. So to further validate this claim, Gabby Giffords was the Arizona congresswoman who in 2011 was shot in the head in the exact same path that Lincoln was shot. Now the differences were it was a gun that was a lot more powerful and Gabby had an exit wound. Otherwise, it's the same path and she is doing so well today. Her husband's actually running for some offices in Arizona. She's doing great. She's talking, she's walking, she's doing everything. So there's more proof that Lincoln would have survived this injury had it happened today. Okay, guys, I'm done. I'm going to leave this up like this because the last time I tried this, you couldn't see it. So I'm going to leave this here. Sean, Liz, anybody chats, questions, comments?
We have one in the chat.
Uh-huh.
So somebody who does, guys, can we keep the volume down here, please, just a minute. They're a weightlifter. Would that be reason enough to start, testing or examinations for aneurysm, or would be more necessary if they had other risk factors?
I would think other risk factors because unless they're like an extreme weightlifter, I would look at other risk factors of being male, white, genetic factors, hypertension, anything like that. Just regular old, what most people do for weightlifting in the average gyms, that's not a problem. It's these guys who are lifting 300, 400 pounds as hard as they can, those Olympics, those extreme sports guys. That's the ones that are showing signs of this. The people who have aneurysms from regular weightlifting also have something else going on, like they have hypertension, they're a smoker, they have genetics, anything like that. So I wouldn't worry about that without knowing what you guys lift. I wouldn't worry about it unless you had additional information. And look at your mom, dad, sister, or brother. Do they have any kind of conditions? Did your grandpa or grandparents die of sudden cardiac death? Maybe something to look into then.
All right, any questions in here? We got 1 second.
The glucose test that she was talking about, if we were to run the glucose test, would that let us know, since we can't do the halo site anymore, that would let us know accurately?
So the question was, as everyone can hear, should we do a glucometer test on possible CSF? Is it worth the test?
It's worth it that you can tell the receiving facility this stuff in their nose is positive for glucose. Don't give a value, because CSF has a different value than your blood, but it's something warranted. It's something to put in their minds. Oh, this was positive for glucose. Maybe we need to consider they've got a meningeal tear. So it's an assessment finding, and you can certainly put it in there. Just say something simple like positive for glucose. That's all you have to say. Put it in your charting, positive for glucose, and then that will put a bug in the doc's ear like, we may have a meningeal tear here. Let's CTM, let's do this and this. Same thing for any drainage out of their ears. Now, if it's bloody, watery drainage, you may get positive for glucose just because there is some blood in there. So that's where it gets a little iffy. But if it's completely clear and it's positive for glucose, then it may be CSF.
All right, Miss Janet, I think that's it.
Thank you, guys. I appreciate it. Enjoy the rest of your conference.